Part two team leader's been changed. Slow down, guys. You got to work together. If Simon's the leader, somebody need to work it out.
Hey, Ken, can you put those bags down and start bagging for them? So you pass through the door. Put these down? Yeah, start bagging for them. Here, switch, and you pick up the bag, I guess.
Let's lower the stretcher a little bit, guys, so y'all can work efficiently. Can you?
All right.
Or keep going either way.
Straight down, all right? Okay, so patient was hitting the head. Anyone know his name?
No, because you left the scene now.
Okay. But he was on the spot.
Okay.
We need to pause for a second, and we need to lower that stretcher so the guy bagging the patient can effectively bag him. He's having a hard time because he's short.
Ready?
Are you still with me?
Not too far. Good. Perfect. And remember, when we get ready to load him, we got to reestablish the height, the load position on the stretcher, okay? We're on our way to the ambulance simulator.
While we're going, I would ideally like to check his pupils as we're walking. And what do I notice when I check his pupils?
Notice that the patient's left pupil is dilated.
Catch the door. Somebody catch that door.
I'm going to check his breath sounds again as we're going.
Okay.
How are they?
I don't know. How are they?
Can't check it as he's walking down the road. You got to wait till you get in the back of that truck and reestablish proper airway management and assessment.
You need to go up here.
Okay, you're mute.
Ready? 1, 2, 3.
You're doing a good job, buddy. I just want somebody else to kind of take some more responsibility.
Lock in. Ready? 1, 2, 3. Talk to him. Junior, you lead now.
Alright. We'll reassess my airway painting. Okay, Cyan, let me get an IV on him. Go to the monitor, let me get an EKG. Catno. We're going to transfer the oxygen.
Make sure you turn it on.
To the machine. I want a maxi drip.
Untangle it.
Time of IV.
Size, what size?
Let me get a 100 milliliter bag. You talking about the gauge?
Yes. What
I'll
size
get an
IV?
18.
Has nothing to do with bags, right? Just what IV do you want? Large
The
board,
gauge.
small board?
The gauge.
Large board.
Okay.
Alright, you got that hooked on? We got the Catno.
IV's established.
The Catno. Sir, sir, do you hear me?
No response.
No response?
What's
He
up,
said he had
You can come
I'm gonna check the back of his head because I remember he said there's a pool of blood. Is there anything on the back of his head?
You know, it's just the road rash type.
Oh, road rash? Alright, I'm going ahead and do a assessment again. And let me get the EKG on him, please. Alright. I'm doing decap BTLS on the head.
Okay, you have a large bore IV established, correct?
Yep.
Yes, sir.
Okay.
Decap BTLS on the head. You just said there's like road rash on the back of his head. Alright, I'm checking the pupils.
Okay. The guy ahead saying extremely difficult to bag. It's becoming more difficult to bag.
And you're not getting good effective chest rise?
Alright, hey, give him the airway bag and let me get
Let him handle the airway management.
Him?
Yep.
Okay.
We want him to intubate this patient.
So you guys
So you need to verbalize everything, okay?
Go ahead and intubate the patient. Alright? Hyperoxygenating him.
Junior, you continue the assessment.
So, just
Cyan, really.
We're going to intubate him with the ET2.
Who's bagging?
Junior, you're going to keep bagging.
Remember,
Get it set up.
that's their job. You're still doing what?
The assessment, focus assessment.
Okay.
Verbalize your equipment.
Hey, checking my
He's already checked out the head.
checking my equipment. I got a Mac.
So we're gonna
number
check
4
out the
blade,
chest. for
making sure the
any
light
flow
works.
segments, equal rise and fall.
Okay. The same
Got my
for
syringe.
paradoxical movement on a
Got my-
patient's.
We
What is it, less
already got
test?
the bulky
Got
system
number
there
7
holding it in
tube.
place.
Okay.
Okay. When he comes back, I'm gonna have him reassess his pulse, rate, rhythm, and quality.
Okay.
And he's
Number
still waiting to be
7 tube. Gonna go ahead and
intubated.
check my bulb, make sure it works.
Decap BTLS.
All right.
Decap BTLS in his arms, pelvis, in and down. The abdomen, any tenderness or rigidity.
Okay.
Decap BTLS
Let's go, guy.
Got my bike tube.
on his legs.
Right next to me.
Notice anything?
Nothing.
Decap BTLS on his legs, anything? Okay. So,
Alright, I'm ready to
chest is taken care of, the head's taken care of, and we're ready to intubate.
ready to intubate. I got 10 seconds.
Ready?
Yes, sir.
Talk about where the blade's going and everything.
I'm going from right to left. It's pushing up in the molecular space, indirectly pushing up the epiglottis. Inserting the tube. This is a 7, so I want to hit it right at around 21 at the T.
Rate, rhythm, quality.
You're going to inflate the bulb. Junior, go ahead. Put me up on the house. In there.
Uh-oh.
Capno, let's get the Capno in place, guys.
What are you missing? There it is.
Let's go. Who's ventilating and who's evaluating?
Let me get this for you.
We already hooked him up on an EKG, but it's not going to be actually attached.
Who's doing evaluation of the ET tube? This is not fit.
Yeah, I gotta get another.
Come on, guys.
Try that one.
Okay. We never got a blood glucose.
Listen to lung sounds, man.
Okay, what did you say, buddy?
Yeah, listen to lung sounds to make sure.
Okay, and what's your true confirmation?
Waveform and capnography.
What do we got going on, team leader or airway person? What's up?
Is he finished here? Okay. So we have the inline capnography.
Is the tube in? Have we checked it yet? Why are we securing the tube without checking it?
We're gonna check for breath sounds in the stomach, or epigastric sounds first, and then go to the lungs. Do I notice any air?
Nothing noted.
He's got a bag.
Huh?
He's got a bag for you. How are you going to evaluate without... Go. Listen now.
Yeah, there's air in the lungs or in the stomach.
Do we have waveform? We don't have waveform, so what do we need to do? Team leader, airway guy, what do we need to do?
We don't have any waveform, go ahead and pull it out. And
Well, let's pull it out. We need to go with an alternative airway device because it's a trauma patient.
Alright.
We only get one attempt. Go with a king tube, please.
Alright.
Okay, so while he's doing that, you get a
Reoxygenating. Good job, Junior. King tube, not a combi tube.
and blood glucose. What's the blood glucose?
Oh, sugar is 32.
Sugar's 32.
Yeah, if you were to ask bystanders, his sister was there, he's non-diabetic.
I'm gonna have him pre-oxygenate my patient.
Okay. You want me to actually administer a drug?
What do you want to do?
We're going to.
How much air goes in that king tube?
What were you going to give him?
Let's see,
Dextrose.
about 80.
Okay, you got your syringe ready to go?
We have 3 different types of dextrose on our drug box. D50?
Yeah, D50.
Okay, and we'll give it
You can use that 20. Just use it 4 times, bro. That's all.
Alright,
So 25
Let's go. Let's get an airway on this
I'm gonna go
guy.
ahead and put in a king tube.
25 grams. Doses.
Ready? Yes,
5
sir.
grams. How many?
25 grams of 50 mLs.
How far do you push it down?
25 grams, we're going to give all
Push
50
it all the way
mLs.
down.
Okay.
I'm gonna go ahead and inflate the tube, the bulb.
And the intubation is.
Go, do it. You just hit the railroad tracks at Gore. You're close.
40, about 60,
Okay.
about 80.
What was the EKG
Go ahead.
reading?
Oxygenate the
Okay,
patient.
you need to take the BVM, please, and let's stop letting people do the work for you.
Alright.
Okay. We're going to check the gastric sounds.
All right, it doesn't ventilate right away. What do you need to do?
Pull back.
Okay, pull back a little bit, and you seat it and ventilate now. Nothing in the belly.
No gastric sounds.
Got a little bit in the lungs. A little bit in the lungs. What's our confirmation?
CO2? CO2.
Let's get it on. What's normal CO2?
35 to 45.
Okay, let's get it on. Let's get inline CO2. Let's prepare him to offload. You're about 10 seconds away from the hospital. Part 3 coming up.